and distribution of drugs in this country has been pathetically bad. Okay, let's move to the next. Okay, so just to give an idea of board, if not only that there's a huge variation between states, even within a district, so for instance in Bihar, if you look at inter-district variation and drug spending, again a huge variation between districts. Districts like Buxar spending about 7 on an average to about 780. So that's about drug expenditure per illness episode. But if you look at drug expenditure per capita, the per capita is as low as about 1 rupee to about 84 or so. But 84 is an outlier. So we say about the state. Well, interesting thing is, if you look at Bihar, on an average they spend about 8 rupees on drugs per capita. On the other hand, if you look at states like Tamil Nadu or Kerala, on an average per capita spending is about 40-50 rupees now. Now it's a little much higher. Okay, let's move on. Okay, so given the fact that the government is spending so low, as I said, it has implications for availability of medicines. So availability of medicines is a big issue. So we have looked at again the national sample surveillance, and if you look at this chart, what does it tell us? It tells us about the state-wise availability of free medicines or partly free medicines available at government facilities. Now, if you look at, given the fact that most of the drugs are dispensed at the outpatient care level, if you look at this side, it is apparent that one of the top state as far as outpatient expenditure drugs available freely is, the major one is basically Tamil Nadu, followed by other states. And of course, states like Bihar are almost on the lower end of the spectrum. And the same thing goes with free medicines available anyhow if it is in the hospitalization or inpatient coverage. Now, why did I say this? Now let's look at the next couple of charts and try understanding what is happening out there. Just a comparative scenario of availability of drugs. These are availability of essential medicines, which is about 25-30 medicines which are supposed to be available in public health facilities, especially in PHCs and CHCs. Okay. Most of the PHCs are supposed to have at least 25-30 essential medicines supposed to be dispensing it freely. Now, we did a survey in Tamil Nadu and Bihar, and the evidence is very clear. If you look at Tamil Nadu, for instance, the availability of the basket of essential medicines is about 89-90% in Tamil Nadu, as against about 33% in Bihar. Next. So that's about availability. What about stockouts? Again, stockouts, if you look at stockouts of drugs, again, Bihar performs badly as against Tamil Nadu. Before I move forward, need to understand why this is happening. It's just not only that the state of Tamil Nadu spends a lot, Tamil Nadu and Kerala spends a lot, but there is an issue of procurement and distribution system. Because if your procurement and distribution system is inefficient and unreliable, then you may still spend a lot of money. If your procurement and distribution system is bad, you might still have lots of shortages and stockouts. So that's the crux of what I'm trying to say. Okay, next, let's go to the next. So the first thing that I try to address, one of the major barriers that I was talking is about the unfair health financing mechanism. The next one, we talked about the issue of procurement and distribution system. The third major issue that, as I said earlier, India, of course, not only boasts of being the pharmacy of the global south, but interestingly, as I said, India also is one of the major culprits in terms of producing irrational manufacture of these drugs, manufacture, prescription, dispensing, and use of medicine. Now, interesting, as I said, 92,000 brands in this country. No other country has this. So, look at this, for instance. We have looked at the IMS data set and then try to understand what are the kind of medicines that this our people in this country prescribe and use. If you look at the top 40-50 drugs in the country, almost 10 of those drugs are highly irrational. It is irrational because it could be irrational cough syrup, or it could be useless liver drugs and whatnot, needless antecedent, so on and so forth. These are essentially, so it's not only that the problem of safety, the issue of cost effectiveness also comes into the picture. So, irrational use of medicine is a big issue which we need to tackle. Next. Well, we have also looked at irrational use of medicines in public health facilities. The one that I showed in the last slide was irrational use of medicines in the private outlets. But this is again irrational use of prescription in public health facilities. Now, if you look at some of the look at this thing. For instance, the percentage of fixed dose combinations available in public health facilities. There's hardly any fixed dose combinations in Tamil Nadu public health facilities, as against about 7%. Just to give an idea, percentage of encounters with a syrup prescribed, less than about 3. Bihar, it's about 26. Why is this happening? Even in public health facility, if you have a proper EDL and a procurement and distribution system, you wouldn't have had this. You would have had something like this. But then we end up, since our procurement and distribution system is not efficient, and moreover, we don't follow EDL in most of our public health facilities, you end up with these kind of bad indicators. Well, yeah, I'm going to little quickly rush through because of the fact that I'm running out of time. I'm not going to talk about the price issue because I guess Chino is going to address the issue of prices. So for the issue of time, I'm going to skip this issue of prices, which I guess Chino will address. Next. I'll go to the next. Yeah. Okay. So what do we do? Does the country have enough resources? Do we have the capacity to provide free medicines to everyone? I think we certainly yes have. Well, the policies are wrong. The kind of policies that we adopt and we follow are bad, but we have the adequate resources. We have the capacity. A country which produces essential generic medicines to 193 countries around the world, I don't think we will have the problem. We are the one who is supplying drugs, quality and affordable drugs to almost every country in the world. So there is no question of capacity. Of course, we do have the capacity. We have adequate resources. So what we have come up with is the high-level expert group on universal health coverage recommended that India needs to scale up its public healthcare spending from the current 1.2%. I'm sure you all know the fact that India, if you look at 200 countries, if you rank 200 countries, India would be somewhere in the rank of 190 in terms of public health spending. So what we need to do is to scale up public spending from the current 1.2% to at least 2.5% at the end of the next 5 years, the end of the 12th 5-year plan, and to at least about 3% the end of the 13th plan. So we're talking about the next 5 to 10 years. So we need to really double up the public spending, and out of which we believe that government need to spend at least 0.5% of its GDP on healthcare, which is about 30,000 crore of rupees. Now, how do we do it? And in fact, it has larger implication. If the government starts spending more and more on public spending, especially on drugs, it is very apparent, as you have seen in the first chart, most of our problem with household spending is essentially due to drugs. So if the government starts spending more and more, you would expect out-of-pocket spending to come down gradually over the next 5 to 10 years, quite substantially. Having said that, just putting money is just not enough. We also need to strengthen our public procurement and distribution system. A centralized procurement in each state, but a decentralized distribution. That's the model to go about. The model that we have in Tamil Nadu and Kerala, centralized procurement and decentralized distribution, I think is the way to go about. And certainly it can be replicated. There is no problem with replicating that model. The simple model can be replicated. Every state can replicate it. I don't see any problem in that kind of model. And of course, the other major thing is Ayush medicines. Again, we need to have Indian system of medicines into a public health facility. It is again, it's extremely important. Well, having said that, I just have two slides. Well, drugs and vaccine security is extremely important. It is important given the fact that now, at least our top 5 Indian drug companies are being acquired by the multinational pharmaceutical companies. A country which has about 10,000 pharmaceutical units, we're talking about drug security now. Yes, we need to talk because of the fact that most of our top-end pharmaceutical companies, Indian companies, are being acquired by the international pharmaceutical companies. So there is a need to do something about this. So what is the way? One, of course, we need to revive the public sector undertaking. The IDPL and the HAL, which has been sick for a long time, there is a need to revive those units. It's high time that we do it. And it is also important given the fact that if you revive PSUs can really help us in terms of in many respects, which is one is proposes to benchmark cost-based pricing, and of course, if the government wants to operationalize compulsory licensing in the event that we have a product patent regime, we need a public sector undertaking. And of course, this is again an important issue. The active pharmaceutical ingredients. The last 10-15 years, India has become a major import-dependent country. Until about late 80s, India has had self-sufficiency in bulk drugs production, what is called API production. But now, the last 15-20 years, our dependence on API has gone up tremendously. And I think we are really in a very bad situation in terms of API dependence. So if you revive PSU, there is a possibility that we can, to some extent, resolve this issue of import dependence. And of course, revisit the FDA rules. I think I'll last. Yeah. So what we suggest, this is my last slide. What we're suggesting is, as I said, India needs to spend at least, currently the government spends about 0.1% of GDP on drugs, on drug procurement and distribution. So what we're suggesting is, the government needs to spend at least a minimum of 0.5% of its GDP on healthcare, on drug procurement. And if you do that, what would be the expected outcomes? Substantial reduction in out-of-pocket spending. In fact, we can see a reversal of out-of-pocket spending, government spending, in favor of against out-of-pocket spending. And of course, this can in fact we can come up with a huge cost reduction, cost savings. Currently, the country spends about 65,000 crores of rupees on drugs. Nation as a whole, both in public and private put together. But if the government starts spending and spends about 0.5 percentage, we can certainly look at something around almost, we can say the country as a whole, the nation as a whole can save up to about 0.5 percentage of the GDP. That's a lot of money you can save. And of course, having done that, it can certainly reduce lots of irrational drug use and of course, this can be done in, some of the things can be done immediately. In 1 year time, of course, public procurement and public distribution can be done. Can be strengthened. It's not a big thing, it's not something rocket science, it can be easily done. We just need money, need to put in procurement and distribution system in place. Just 1 year it can be done. Except that the warehouses might take time to build. In addition, given the fact that we rely a lot on the market, people prefer the market. The next 2 to 5 years, there is a possibility if the government spends a lot of money, then the other distribution system can also be taken care. In the sense that, for instance, we have Jan Aushadhis now. The problem with Jan Aushadhis is they're essentially they're part of our public health system. Ideally, they should be outside your public health system. What we suggest is we should have more and more such stores outside the public health system. The government can procure centrally and distribute that drugs to these stores, but it should be ideally outside the public health system. That's all. Thank you.
Thank you. The issues are going to be overlapped in these 4 presentations. I shall have on you to resolve your questions, so that at the end of the 4 presentations we can have a panel and formal discussion on the issue. I shall now call Dr. Samit Sharma. Dr. Samit Sharma is a medical graduate. He is a pediatrician by specialty, and he is in administrative services for more than a decade now. He is one who did a wonderful work in Chittor district when he was the district magistrate of the state district. And subsequently, for a short stint, he was mission director of NRHM in our district. And right now, he is looking after a huge project of the state government of free distribution of medicines to all the public practices. Dr. Sharma will talk to you on the issues that he is facing in managing this project.
First of all, I'd like to thank Meera Shiva Madam for giving me this opportunity to face all of you, because I'll be discussing about a very important issue which many of us are not aware of. And हिंदी बोलता हूँ फिर। जब हम अभी अच्छा सा खाना खा करके, अच्छे कपड़े पहन करके इस कमरे में स्वास्थ्य सेवाओं का कैसे सुधार किया जाए, उसका विस्तार किया जाए, उन्हें कैसे अच्छा किया जाए, इस बारे में चर्चा करने के लिए जमा हुए हैं। ठीक इसी समय एक हेल्थ क्राइसिस चल रहा है, एक त्रासदी घट रही है, एक